So good morning, everybody. It's my pleasure to welcome you to an exciting day for residents of the city of New Brunswick. I'm Jim Cahill, Mayor of the city of New Brunswick, and we gather today as we launch a new era in access to health care. New Brunswick residents will now be able to offer or receive access to telehealth medical services, a real game changer in providing quality health care in a modern and convenient way. This helps to bridge the gap between doctor and patient and removes barriers that may have previously limited access to care, particularly among our Hispanic and Latino residents. With the New Brunswick Free Public Library and this location at the New Brunswick Housing Authority serving as off-site hubs, we are well positioned to bring patient and doctors together in a modern, convenient, safe, and time-friendly manner. Parents will now be able to schedule appointments for themselves and for their children with minimal disruption to the work and school days, and doctors will be able to see more patients and provide better care using this modern technology. We all learned to appreciate the value of remote connections during the height of the COVID-19 pandemic. This technology helped our businesses remain productive and allowed our students to continue to learn without access to a classroom. Now this technology advances to create a new way for healthcare to be offered to the community. This platform will be able to provide around-the-clock access to information about exercise, diet, and medical content that will prove valuable to anyone with access. So I want to thank Director Ron Rios and all the Middlesex County Commissioners and New Brunswick Tomorrow and its President, Jamie Santiago, for working together to bring this exciting new program to fruition. This will help the community to be healthier, stronger, and more connected than ever before. I also want to thank Assemblywoman Lopez, Commissioner Ascono-Barber, and Manny Castaneda, New Brunswick Tomorrow's Director of Community Health, for all that you have done to bring this program from concept to reality. Thanks to this new initiative, access to necessary care will never be easier or more convenient. So thank you very much. It is now my pleasure to introduce a great leader and a great partner to the City of New Brunswick, County Commissioner Director Ron Rios. Supposed to stand here? Is that good? Okay. Thanks, Ronnie. Sorry.
Good morning. Thank you, Mayor, for those kind words. I like this mural. We are one. And yes, we are one big community. It's partnerships between county, state, and municipal. And we have a great relationship with the City of New Brunswick under the leadership of Mayor Cahill. Thank you all for being here as we launch the next phase of our telehealth program. I'm pleased that we're bringing this community-based healthcare initiative to New Brunswick after successfully launching it in Perth Amboy last year. The telehealth program and community health team initiative were created in direct response to a need that we recognize in our communities. Early on in the pandemic, Assemblywoman Lopez and I had several conversations among advocates who expressed concern about the limited access to healthcare and healthcare information experienced by many of our local Latino communities, especially residents for whom language or a lack of health insurance might be barriers to seeking and receiving healthcare. The telehealth program and community health team initiative were created with the ultimate goal of expanding awareness to healthcare and for all county residents. Of course, an initiative like the telehealth program cannot succeed without the support of trusted partners, especially partners who already have the trust of the people in their community. I'd like to recognize our hospital partners, Hackensack Meridian, Robert Wood Johnson Barnabas, and St. Peter's, as well as the Chandler Center and other partners who brought the program to fruition. We are fortunate to have the Raton Bay YMCA as our partner in Perth Amboy, where the success of the telehealth program is directly related to their hard work, dedication, and expertise, and of course, their existing relationships within the community. We are equally fortunate to have New Brunswick Tomorrow as our partner here in New Brunswick. Telehealth in general has grown in popularity over the past few years, helped along by the pandemic, which took the need for virtual health care consultations beyond mere convenience. However, so many people remain unaware of the availability and benefits of telehealth, especially the people in the very communities we are trying to reach. I, along with the entire Board of County Commissioners, am grateful for the support of our valued partners in Perth Amboy and now here in New Brunswick, for their help in bringing this information right to the doorsteps of those who need it most, and for helping it make it possible for these people to actually see telehealth. In 2022, it is easy to forget that not everyone has a smartphone or internet access. So providing secure access to that technology and confidential support in using it is invaluable for the communities we are trying to reach. On behalf of myself and my colleagues on the Board of County Commissioners, I thank New Brunswick Tomorrow for joining us in this initiative. I look forward to working together to help ensure that every Middlesex County resident has access to health care. The board and I also extend our thanks to Mayor Cahill for his ongoing support of this initiative. Thank you, Mayor. You and your team are always a pleasure to work with, and your support for this project is invaluable. Thank you again, everyone. And it gives me great pleasure to introduce my colleague, Commissioner Clarabelle Ascona-Barber.
Good morning. Buenos dias. As a Middlesex County Commissioner and resident of the City of New Brunswick, I join Assemblywoman Lopez, Director Rios, Mayor Cahill in celebrating the expansion of the county's telehealth program in the City of New Brunswick. So many New Brunswick residents, especially us in the Latino community, can benefit from this program. Telehealth provides you with the ability to connect to healthcare providers in a new way. The goal is to improve access to telehealth care in the city residents. Imagine having direct access to your doctors from home, less in-person follow-ups visits, easier monthly prescription, and quick labs result. It is safe, secure, affordable, and can be important to part of our all health well-being. Having providers that are Latino, bilingual, and have specialized training in the service you need. This is possible because of telehealth. In addition to a home access, 2 coordinators will be located in New Brunswick, one at the Public Library on Livingston Avenue, and one right here at the New Brunswick Housing Authority. To get our message out, we need a partner. Today, we are happy to announce our partnership with New Brunswick Tomorrow. For more than 40 years, New Brunswick Tomorrow has built community relationships and worked with the city residents to address social and economic issues. Community relationships are critical to programs like telehealth, and we could not ask for better partners like New Brunswick Tomorrow. And in Perth Amboy, the Raritan Bay YMCA. Thank you. Director Rios often speaks to the importance of working as a team, and this is an example of a teamwork between the county, the city, and social service agencies to keep improving health care to New Brunswick residents. I look forward to working with New Brunswick Tomorrow on what I believe will make a difference in the lives of many New Brunswick residents, especially those with limited access to health insurance options. Together, we can keep building a stronger, healthier City of New Brunswick and Middlesex County. Thank you, gracias, God bless you all. And now, I have my pleasure to introduce our next speaker, an advocate to all New Jersey residents, a person who has worked so hard on this initiative, and a true leader of the Latino community, and someone I consider a friend, Assemblywoman Yvonne Lopez.
Good morning, everyone. It's a pleasure to be here. What a beautiful day. The sun is shining. It's not raining. Thank you everyone for being here today. I'm delighted to announce the expansion of the Middlesex County Latino Health Program in the city of New Brunswick, building upon the success of this vital initiative. Thank you, Mayor Cahill. Thank you very much. As many of you are aware, the Latino Telehealth Program was born out of a conversation with statewide Hispanic leaders who spoke about the tremendous health disparities facing the Hispanic community and the opportunity telehealth had in increasing access to care. Over the course of the program's development, we have achieved great success in increasing awareness in telehealth services in my district. And thank you to Steve Jobin for the YMCA for hosting our hub there. And I know this program would be just as impactful for the residents of New Brunswick. As a legislator, I have been a longtime proponent of telehealth, sponsoring legislation at the height of the COVID-19 pandemic to extend the use of telemedicine and telehealth, and supporting legislation to expand the practice of telemedicine and ensure that it remained a covered service for patients. Telehealth in many instances saved lives and allowed patients to remain connected to their healthcare professionals, and today remains an integral component in addressing mental health and ensuring access to services. Telehealth is the future of healthcare, and I am, little bug, and I'm encouraged by the results that this program has achieved in uniting healthcare providers and community-based organizations to increase awareness among the community and hopefully encourage patients to use a service that is safe, convenient, and confidential. Middlesex County embraces innovation at every level. Thank you, Commissioner Director Ron Rios. And I am proud to be a part of this amazing program and excited by the news of this expansion. I look forward to the outcomes it will achieve for the Hispanic community at large. Thank you very much, everyone. I'm now going to introduce Jamie Santiago, President of the New Brunswick Tomorrow, Director of Program of Operations. Thank you.
I'm a little taller. So good morning, everyone. I'm so glad to see everyone here today. It's really my pleasure to be here for this exciting announcement. You heard a lot about New Brunswick Tomorrow, so I figured I should say a little bit about who we are and what we plan to do. And also, I just want to highlight that, Commissioner Ron Rios said, we are one, and the truth is, we really are. When we think about this work that happens in our community, it's only together that we can do such great work. And so I'm looking at state officials, I'm looking at county officials and city officials, but I'm also looking at our community partners in the back and sitting in the seats. I mean, together we really can do quite a bit, and we truly believe that. At New Brunswick Tomorrow, we're focused and committed to actively raising the quality of life for every resident. And so what does that mean? Our aim in this city is to help people. And so we like to say that if there's an issue that affects you, we want to get involved. If you've come into our office, particularly lately as we remodeled, there's a slogan on our wall that says, moving people forward. We've been blessed to be able to do this work for about 45 years, and we take that charge very seriously. For our youth, we work with young families to help them get their babies ready for school. Once you're in school, there's an array of support services that we offer designed to help kids stay in school. And when you graduate, we're helping those kids get to college or get a job, right? Every parent's wish come true. So we work for our youth, but we also work for our neighborhoods. We focus on building strong communities by providing needed services, improving neighborhood safety, growing small businesses, and creating pathways for homeownership. We get involved and we do these things because it's the right thing to do. And lastly, with this launch, we focus on health initiatives. We are moving people forward once again in the area of health and healthcare access. There's no question that access to quality healthcare is a critical component to achieving a high quality of life. And as the world embraces more and more digital platforms and virtual connections, we'll set out to bring learnings around how Black communities, how brown communities, and how immigrant communities, folks that are often left behind in our country, can best use these services for improving health outcomes. If the pandemic taught us anything, it's that these kind of innovative and equitable initiatives are needed more now than ever. So I'm proud to stand with our municipal, county, and state leaders in this effort. Thank you all for this honor. I'm excited to see you all, to see us off on this journey. God bless you all. With that, I want to introduce kind of the engine behind this work. My right-hand person for the last 10 years, Manuel Castaneda, our Director of Health Programs at New Brunswick Tomorrow.
I'm not that tall. All right. Buenos dias. Good morning, everybody. Thank you, Jamie. And thank you all for being here. As Jamie mentioned, as one of the leads here to try to get this here in New Brunswick, it is a day that I know is personally warm to my heart to be here and see the launch of what I feel is an important service here in the city of New Brunswick. So access to healthcare and health information is essential to achieve positive health outcomes. We at NBT work towards meeting these health needs of the people of New Brunswick. Improving access to healthcare by promoting telehealth as an alternative access point is one of our main priorities. COVID-19 showed us the importance and benefits of having a telehealth option when there's challenges to meeting in person. For many in our community, especially those who are marginalized, a telehealth option can be more than just a convenience. It could be the difference in getting people necessary healthcare when time, transportation, general mobility, and other issues just don't permit for a face-to-face visit. In order to do this work, we at MBT recognize the importance of working not for the community, but with the community. As such, we're working together with our community ambassadors who are an integral part of our community outreach efforts. Their efforts have been integral to the success of local health initiatives, like our diabetes community outreach program with St. Peter's University Hospital and the New Brunswick Healthy Housing Collaborative. They are New Brunswick community members who have decided to do their part to better our community and who recognize the importance of promoting health and wellness. And so they're sitting in the back here. I want to give them a big round of applause for all the work that they do. We thank the county for this opportunity to partner with the City of New Brunswick, the New Brunswick Free Public Library, the New Brunswick Housing and Redevelopment Authority, and the healthcare partners to promote and provide the communities of New Brunswick, in particular the Latino community, with education and technical assistance in using telehealth, while also learning what works and what doesn't work to better the telehealth experience and work towards truly making it a viable option for all. Lastly, we also look forward to learn and to collectively support the other telehealth initiative in Perth Amboy. Thank you very much. Are we all coming? I think I'm going to ask everybody that spoke, all the delegates, I think we're going to take a picture. Thank you all for coming.